Great, Rex. We can hear you just fine. We can see your screen. Everything looks great. It is my pleasure to introduce Dr. Rex Paulino to this group. Rex is a geriatrician and palliative care physician at the University of Texas Health Science Center at Houston, UT Health. He's the program director for the Hospice and Palliative Fellowship, and he has several leadership roles, such as the president of the Texas Consortium of Hospice and Palliative Medicine. He's a member of the HPM Fellowship Training Committee, the AGS Ethnogeriatrics Committee, and the co-chair for the Chronic Care USMLE Test Material Development Committee. And what Rex didn't mention is that he is the reigning champion of the AHPM Studs of Palliative Care competition. I didn't receive a single vote, but Rex, we're very glad that you're here and look forward to hearing your talk.
Those parentheses, Alzheimer's disease.
Oh, do we lose Rex?
Oh, there. Okay, perfect.
Gotcha.
Yeah. So thank you, Ben, for that introduction. And just as a heads up, so when I gave this talk to the consortium fellows last academic year, that was February. And while that was, still early, at the end of that talk, I kind of realized that I was giving that talk too late. So, and as I reached out to Ben when he was like looking for like different potential speakers, I thought, well, maybe it'll be like a good introduction to talk about the certification exam to everyone, July, so that y'all can start preparing. And in a couple of slides, maybe y'all will understand why we need to prepare for this exam. Yeah, and I don't have anything to disclose, but I am going to invite everyone to join Poll Everywhere. So like towards the second half of the hour, we'll try to keep it as interactive as possible. So you can join via web, and or you can join through text, and just sending Rex Paulino 636237607. Messaging and data rates may apply. I've always wanted to say that. All right. So first of all, we're going to talk about the format of your certification exam, and then after that, go over some tips and tricks on how to prepare for the exam. And lastly, we'll apply some test-taking strategies that y'all can use, especially when you're guessing and making an educated guess. So what are some strategies that we can use to help you whittle down some of the choices and help you eliminate some of the potential wrong options? So this is the exam blueprint, and really all of the information that I will be presenting to everyone today are available on the web. So these are all publicly available to everyone, but what I did was I tried to compile everything so that hopefully it can help facilitate everyone when it comes to your learning process. So this is the spread of the blueprint of the entire exam. As you can see here, a good majority are going to be revolving around managing suffering and distress. 40% and 20% encompasses the comprehensive whole patient assessment. So just by that, that's already like 60%. Then prognostication is an additional 10%, and the rest is like broken down into like all different aspects of the exam too. But more importantly, what y'all need to know is there are 240 items on the exam, 40 of which are considered experimental questions. So what does that mean? So these 40 items do not count towards the final score that you get after the exam. And this is not uncommon to do. So different certifying bodies or different different organizations who develop all of these items, they have to create newer items, and what happens is these items are brought into a testing phase So I'm not sure what's the testing phase for HPM, but like for example for NBME and USMLE, it's typically like 3 years. It goes into like a testing phase. After that, the uh, the the scores, like how the items are performing in real life, are sort of like kicked back to USMLE, and then they can analyze which items are great items, which ones are great discriminators when it comes to really figuring out which test takers are really know their craft and really know the correct answers, or which ones are just good test takers and which ones are like not really good when it comes to discriminating people who know the answer or who don't know the correct answer. So 40 of these items are going to be experimental. It's going to be 60 items per session. Every session is going to take 2 hours. So it's a 2 hour block composed of 60 items. So if you think about it, you're really looking at 2 minutes for every item on the average for you to be able to complete 60 items for every block, and that's 2 hours. And then you do that 4 times, and then that's 8 hours of you taking the test, and then an additional 2 hours that's shared between your break, and around 30 minutes of that 2 hour block is can be dedicated for your orientation. So whenever you go into the testing center and you're trying to navigate um, through the system, you can spend 30 minutes doing that, or you can do that beforehand before you take the exam, so that the extra time that you can save up can go towards your break. But it's a total of 10 hours of commitment, and it used to be offered every other year, but starting 2024, it's now offered annually. And I think for this year, it's going to be offered. The exam is going to be November 10, which is on a Monday. And I think for next year, it's also November 10. So this is why, and I was talking to Ben about this. This is why I wanted to bring this to everyone's attention sooner than later. It's because uh, across the board over the past couple of years, we have been um, performing at around like 85% pass rate over the past couple of years, and that's from like 2020 to 2024. So we've been on the average 85% of folks who are taking the exam are passing. So what that means is like 15% are not going to make it. And that for me is concerning, and that's why I wanted everyone to be able to prepare for the exam so that we can hopefully bump our numbers. Um, This is just the scores for the maintenance of certification. So folks who are just recertifying, and it's a good amount of spread between like 90% to like 75%. But for the first time test takers, which was from the previous slide, we're looking at like an 85% average for like passing. Now, including the most frequent incorrect items from the last year's exam, and many of these have been similar from the previous exam. So frequently incorrect items would often include like conflict resolution, and these oftentimes would include your communication skills that are tested on the exam. Comprehensive whole patient assessment is a big part of that. Now, this is something new compared to from the previous year. Is there's a lot more people who made errors when it comes to pediatric decision making, and I'd say around like 20% of the items have a pediatric focus. So that's very important to be mindful of. Managing suffering and distress accounts for 40% of your exam, so it's not surprising that many of these items here show up as frequently incorrect items just because they make up majority of the exam. Palliative care emergencies from before, SVC syndrome was a commonly incorrect. Like many folks got these items incorrect. But what was new from the last exam was there was a surge on fractures too. And for prognostication, many folks were like having issues with like prognosticating with like cancer and cardiovascular disease. And that was like similar from the previous exam from 2024. So that was like a quick rundown of the blueprint of the exam, and moving on to like the things that will help us hopefully do a better job with like with going through the exams. Like we'll quickly review some tips and tricks on how to prepare for your exam, and really how do we set yourself up for success. And I think this is like really important. There's no better substitute than preparing for the exam. And that's why we're talking about this, is so that hopefully now that you're starting your fellowship, you would have the tools that you need so you can start preparing for the exam, and you can supplement the learning that you're seeing at the bedside with the material that you read, either through the different references available out there to supplement the learning that you're getting when you're seeing patients. So some of these tips are, you've probably encountered them. Some of them are a lot more obvious, but I think it's important that we're just like mentioning them, just so that we can like help facilitate learning. But adopting the right mindset is always very helpful. For some folks, having a study buddy works. I'm gonna be honest, it doesn't work for me because I tend to psych myself out, and if I see my study buddy is like doing much better, that doesn't work well for me. For some others, it does. So, just see what works for you. Definitely looking at different useful study strategies is going to be very helpful. And I think this is going to be very important here. Really starting weeks to months in advance, preparing for the exam is going to be helpful. And in the next couple of slides, I will show you guys why. Certainly setting up a schedule that you can follow and something that's reasonable is one thing that you want to be able to plan out for, and really trying to meet your goal, and meeting your schedule is going to be very important. And then what's been helpful for me in the past is, especially when you're taking your intensive review board exam, like there are like different courses that are available out there. Whenever you're doing them, a lot of times you're also doing some Q bank. So whenever you're doing question banks, it's always helpful to write out and just take down notes on items that you answered incorrectly. So it helps guide you to fill in the gaps, so you know exactly which materials to look out for and which topics to read up on, so that you can further improve your performance during the exam. Um, Cramming is shown to be less effective, if that is not obvious by now. But spaced retrieval is something that is really important, and it's shown to outperform mass practice. So mass practice is just repeatedly reviewing and studying a topic over and over again. However, mass practice is doing things longitudinally, so it solidifies the knowledge that you're gaining. And that's important because as soon as you learn information, the attrition is pretty rapid. So 20 minutes after, the retention drops to like close to like 60%. And the longer that you are from when you first learned the information, the retention just drops significantly. So that's why what you want to do is spaced retrieval, so that the more that you remember, or try to remember a learned item, and you're trying to remember it um, by reading through it again, and trying to trying to see if you can remember these items from when you first learned it, and by simply by repetition, the better the retention is. And that's really what you want to do, so that hopefully whenever you study the material, you remember them quite effectively. Sleep is going to be very important, especially whenever you're learning, and especially when you're about to take the exam. What I sometimes do is the day before, I do some light reading, nothing crazy. I definitely make sure that I get a good amount of sleep before the exam. And like for me, I can't really prevent myself from not studying the day before, but at least some light reading and just glancing over the notes that I've taken down the day before, and just trying to do as much relaxing that I can do to the best of my ability the day before has been helpful. And definitely preparing for the environment and the conditions of the exam center is going to be important because many of them are going to be cold. So definitely bringing some sweater or jacket along with you and making sure that you have snacks with you whenever you're taking your break is going to be very helpful. Um, Now, for the purpose of the exam, I think it's very important that when you see negative medical behaviors, for the most part, these are going to be wrong. So whenever you see options or option sets that say that you're going to argue with the patient, or one that's saying that, oh, I don't trust my patient, for the most part, these are generally going to be incorrect items. And always trust that your colleagues know what they're doing and that they're practice good medicine. We're not supposed to assume that our colleagues are not competent and that they don't know what to do. I think it's safe to assume that we should expect that everyone is doing what they're supposed to do and that they're practicing good medicine. Um, and if y'all have done standardized exams in the past before. So definitely flagging items that you're unsure about is going to be helpful because it allows you to be able to go back to them before the end of the 2-hour block. And always think of the gold standard if there is one. So if one exists, that's a safe bet to consider rather than thinking about the latest theory. So especially in the field of medicine, especially for cancer medicine, for as an example, a lot of things that are happening. There's like lots of new developments that are happening like almost every month. Um, so even though there are like new treatments that are coming out, if you know that there's like a gold standard or something that's a lot more commonly done, then then it might be safer to go with that option unless you have a lot more data to support that it's no longer considered standard of care. And one other thing to remember is especially if you have like long options, um, if one aspect of that option is incorrect, then that means that whole option set is wrong. So just know that because like each and every item of that option needs to be correct for it to be considered the best answer. And really, when you're taking the board exams, the way that it's structured is you're really looking for the single best answer. This is something neat that I learned from Eric Widera, who's really well known in the world of geriatrics and palliative care, and he's also like one of the guys for the Jerry Pal podcast. But so it's important to note that the first instinct fallacy is a fallacy, and if y'all haven't heard about this, um, it's that thing we're so afraid to change our answers because we're afraid that we might change our answer from the correct one to the incorrect one. But what actually is the case and what studies have shown is that most of the times when we are confident in our ability to dissect the case and when we're confident that we're picking the right answer, what often ends up happening is really we're picking the correct and the incorrect answer first and changing it from the incorrect answer to the correct answer as long as we are confident that we are now picking the correct answer. So what that means is a lot of the times we're overestimating that we are going from the correct answer to the incorrect answer. But really, when we're changing our answers that we initially picked, let's say you read the lead in and you're going through the options. And then after going through the vignette, you're telling yourself, oh, you know what? I initially picked option A, but now I feel like I'm more confident that option C is the correct answer. What the studies have shown is that don't be afraid to change your answer if you feel more confident now that you know that option C is the more correct answer, because oftentimes that is going to help you, and oftentimes that will help improve your scores. So trust yourself and just know that if you are confident that you are now picking the more correct answer, don't be afraid to change the answer and just go with it. However, if you are already confident that you picked out the correct answer, then don't change it. Trust yourself and know yourself and go with what you think is the best. Cognitive fatigue is a thing, and that's why in all of these standardized exams, they make sure that there's built-in breaks in between. And that's because utilizing these breaks help you perform better. Now, this is looking at some test data from a Danish study back in 2009. And really, what happened here is these are children from like a public school, and what ended up happening was these kids ended up taking 20 to 30-minute breaks. So this is that spike there, and then that spike there. And what ended up happening was after the break, they ended up performing better immediately after. So I think it's safe to assume that when you have your breaks, be sure to take them. Just be able to like stand up and stretch and walk around, take your snacks. Certainly, especially for me, like I don't like to take like heavy meals, otherwise I'll fall asleep. And falling asleep during exam is not a good thing. That's happened to me before, and it's like very stressful. But being able to take like short breaks and just some small snacks just to keep you going is helpful because this is a 10-hour long day for you guys, and it's an endurance. It's a marathon in the same way that people who run the marathon don't just run straight and do the marathon. They have to train, and what you need is endurance training. So you need to be able to exercise and be able to train yourself because 10 hours is a very long spread for you to be able to go through the exam. um, there are different study material out there, and no, I am not advertising for AHPM, not, for the academy, but at least for me, what I've found has been helpful, and what we encourage our fellows to use is go through the Essentials book set. So it was previously named the Unipack series, and these items, these material are available through AHPM. There are also a variety of like other reference out there. There's the primer for palliative care, the uh, the uh, the Bible is what I call it, the Black Book from Marilyn McPherson. That's very helpful for understanding opioids and opioid conversions. Although it's really like a deep dive into opioid conversions, and we'll talk about that in a bit. But it helps you really solidify opioid management. So that one was helpful for me too. There are different offerings of board review courses out there. AHPM has one, and I attended that one. That one was very helpful. There's one from MD Anderson. There's also the Pass Machine. There's like Board Vitals. I haven't tried that. So there are all sorts of like different courses that are available. And I think the beauty of like having this as an open forum is like you have like different folks here who have already taken the exam and successfully passed the exam. So if there's like anyone out there who has like any other like reference materials that they find have been helpful, please drop them in the chat. And I'm looking at them right now. Yes, so yeah, so the black book that I was talking about, that's the Demystifying Opioid Conversions by Marilyn McPherson. The second edition came out, I think, like 3 years ago. It's really, really helpful. Um, there are also question banks that are available. So through AHPM, I believe the most up-to-date ones are HPM Pass. That's the fourth edition. I believe that's around like 80 items of like practice exam that you can use. That's been helpful. And also the HPM Fast, the second edition that targets more hospice um structured questions, but those are also helpful because you'll also encounter like hospice questions, hospice items in your exam. And then lastly, and we're like 25 minutes into the hour now, so this is great because I want to be able to like get you guys to do some audience participations. We'll try to do some test taking strategies, especially if you don't know how to approach the item and how to best answer this. And I say this because I've been an item writer for the USMLE since 2021. So it takes a lot of training to be able to create an item and to be able to create one that undergoes several revisions. Several editors have to like go through them, and it's really a long process to really create a good item that will discriminate people who really know the correct answer from folks who don't. But sometimes if you encounter an item that you're just like scratching your head and you're like, I don't know how, or I don't know how to answer this, I don't know why we're being even asked about this, sometimes you'll encounter this either during the exam or when you're doing your practice, your practice exams. So it's helpful to learn some test taking strategies, and we'll try to go over some of these in a bit. So one thing that I tell my fellows is that always read the lead in first, and we'll go through the anatomy of a typical STEM, a typical exam item. So these examples are available also on the web. They're from the NBME Item Writing Guide, the 6th edition. And yes, while these are strategies that USMLE item writers are using, many of the test material folks and like item writers are also following a similar structure. So while item writers are generally trying to avoid these flaws or mistakes, every once in a while something will slip in. And if that happens, then you guys, especially when you're taking the exam, you need to utilize um, test taking strategies so that you can use that to your advantage and be able to eliminate incorrect items. And because maybe that'll help you go from being able to guess the correct answer 20% of the time, maybe it'll help bump that up to 33% or 50%, right? So this is a typical anatomy of your item. And then typically what I would recommend is start off by reading the lead in, because sometimes you will encounter items wherein you don't even have to read the whole vignette. And especially if you are only supposed to, for the most part, spend 2 minutes for every item, you want to be smart with how you're going through your questions. So start with the lead in and see if you can answer the question just by reading the lead in the item. If you can answer it, great. If you can't, then you move on through reading the option set. And just by reading the options, can you now answer the lead in? And if you can, then you don't have to read the vignette. That saves you at least 30 seconds, maybe a minute. However, if you can't answer the question, that's when you go back and read the vignette. For the most part, I feel like that has been helpful and has been successful. Uh, but these are all recommendations, so you always obviously you will want to do what you found has been effective. But you can also try this out and see if it works. So a good item is something wherein all the options that are provided are all possible correct answers, except for many of these standardized exams, you're really looking at which one is the best item, which one is the best option. And if you have a spread like this, wherein item B is the most likely diagnosed, the most likely correct answer, E is close enough, and really options A, C, D, and E are called distractors because it's meant to distract you away from the correct answer. If you have potentially correct distractors, but option B is the most correct answer, that is considered a well-written item. A poorly written item is one wherein option B is the single best answer and all the other options are blatantly and obviously incorrect options. That is a poorly written question. Now, as a test taker, that's actually a good thing because it's going to be easier for you all to figure out which one is the correct answer. As an item writer, that's bad because it's not going to help you be able to identify folks who really know the correct answer. So I mentioned this a while ago, so you read the lead in first. What's also helpful is take note of the keywords. And although many of the item writers will avoid giving negatively phrased items, so example, which of the following is like the least likely to cause this, or if you see words like accept or not, there's a general trend to stay away from these lead-in questions because it becomes an issue of whether the test taker has a good enough ability to comprehend. It becomes a rating task as opposed to you testing if the test taker really knows the correct answer from the incorrect answers. So there's a general trend to stay away from these questions, but every once in a while you'll still see them. So if you see them, just take note and make sure to either encircle or mark or highlight them because you don't want to get the incorrect answer just because you missed a certain word. Then after reading the lead in again, go through the option set and then read the vignette. And then if after that you're still unsure of the correct answer and you're just really trying to guess what the correct answer is, you need to pay attention to the flaws. Because if there are flaws in the item, that can help you eliminate incorrect items. I mean, incorrect options. So we'll talk about that, and I really want to emphasize this. Paying attention to flaws should be a last resort. It shouldn't be the first thing that you're paying attention to. So we'll go over some technical flaws. And for some people, this might not show up as the complete set of options, but so I can read them out. So peer review groups and HMOs may move to take action against a physician's credentials to care for HMO patients. There is a requirement to ensure that the physician receives due process in the course of these activities. Due process must include which of the following: A, notice, an impartial forum, counsel, and a chance to hear and confront evidence. B, proper notice, a tribunal empowered to make the decision, a chance to confront witnesses, and a chance to present evidence in defense. Or C, reasonable and timely notice, an impartial panel empowered to make a decision, a chance to hear evidence, and to confront witnesses, and the ability to, and I can't see the last part. So we'll give it a few more seconds. I still see some answers rolling in. All right, I'm going to lock this in 3, 2, 1. All right. So 76% of y'all picked item C. And let's hear it from everyone. What made y'all pick item C? Why option C? More thorough description, longest. Exactly. Exactly. So this is an example of a flaw. Well, there's two things here. One is that um, the question due process must include which of the following. It's a lead in that like if you read that, you don't really have to go through the vignette. So especially for items that have like really long vignettes and the lead in is something that you can directly answer, it's very frustrating because like you just like wasted like maybe 30 seconds, maybe a minute trying to digest the vignette when in fact you didn't even need to read it in the first place. So that's why read the lead in first, because sometimes you may even skip that whole chunk. But I agree. So I think the flaw here is that option C, which is the longest one, is a long or complex option. And this is a flaw because it becomes an issue with the increased reading load. So you're no longer testing if the person who's taking the exam understands the question and knows how to answer the question, but it becomes a reading assignment. And that's not really the purpose of the exam. So, and one other thing is that since it's like so long and overly complicated, it's almost as if the item writer is trying to convince you that this is the correct option. Now, it's not a guarantee that it's always going to be the correct option, but it's something to consider because it sounds like they're trying to lead you towards that option, if that makes sense. So the important thing is like make sure to read the question first, and then if you see a long or complex option, see if that makes sense and maybe go with that, especially if it's trying to convince you that that's the correct option. All right, for the second one, after a second episode of infection, which of the following is the likelihood that a woman is infertile? A, less than 20%, B, 20 to 30%, C, greater than 50%, D, 75, E, 90%. All right, I'm going to give it 5 more seconds. All right, and now lock it. So this is a type of flaw wherein there's numerical data that's presented inconsistently. And that's an issue because normally what you want to see is either the options are all exact numbers or all ranges. So if you see options A, B, and C, they're all encompassing. It's either it's a range from less than 20 to 20%, option B is 20 to 30%, and option C is greater than 50%. Now, the thing here is option D and E are automatically incorrect answers. And why is that? Because option C covers both options D and E. So that means there's no way that option D and E are potentially going to be correct answers because that means option C is also going to be a correct answer. Um, I am going to be honest, many of these questions that I've included here are NBME questions from the sample guide. I don't know the answer to some of these questions, and I tried to do my research to figure out which ones are the correct answers. So for this one, I apologize. I don't know which one's the correct one. I think the important thing to realize here is looking at your options, you should be able to identify that option D and E are incorrect because otherwise option C is going to be able to encompass those two options. And then you're only looking at options A, B, or C as potentially correct answers. All right, next question. So I have a question. So the type of infection is irrelevant. So that is a good question. Um, Yes, I mean, like that is a good question. I don't know how to answer that question. The purpose of this specific item is to identify what is the flaw here, uh, because I don't even know what the correct answer is, and I tried to scan through the up to date, find trying to figure out what is the the single best answer, but unfortunately I don't have that answer. So yes, unfortunately I cannot answer that question. All right, next one. In patients with advanced dementia, Alzheimer's type, the memory defect is A, can be treated adequately with lecithin. B, could be a sequelae of early Parkinsonism. C, is never seen in patients with neurofibrillary tangles at autopsy. D, is never severe. Or E, possibly involves the cholinergic system. So I guess the purpose of the next couple of slides is let you guys see what are the flaws and help you identify them. And if that helps you remove some of the incorrect options and help you guess what is the correct answer, that's great. Also, if you know the correct answer, that's even better. All right, so we'll give this 5 more seconds. So, and then we'll close it. All right, so 80% of you all here picked option E, which is the correct answer, right? But for those of y'all who who answered this, what was the issue? What was the flaw here? The word never is extreme, absolutely. And I think that's a takeaway here is absolute terms are automatically going to be incorrect answers, right? So every time you see the word never, always, I think it's safe to assume that those are going to be incorrect because medicine is never absolute, right? All right, next one. Severe obesity in early adolescence. A has a 75% chance of clearing spontaneously. B often is related to endocrine disorders. C shows a poor prognosis. D usually responds dramatically to dietary regimens. Or E usually responds to pharmacotherapy and intensive psychotherapy. All right, we'll close this in 5 seconds. All right, so these are example of vague terms, and the reason why I didn't show the result, I mean, like the correct answer is like I couldn't find it. I really tried my best to like look for the correct one, but looking back and going back to the previous example, absolute terms always going to be an issue, never going to be the correct answer. And pun intended, I used like always and like never, right? But comparing absolute terms and vague terms, even though it's still frowned upon, it's going to be better than your absolute terms. So when you see usually, often is, these are vague terms, and comparing between absolute terms and vague terms, vague terms are going to be better. I'm not saying they're always going to be the correct answer, because the problem with vague terms is since they're quote unquote vague, even experts often have disagreements on what is considered usually, what is considered often. And I guess the point is just pay attention to these terminologies, especially for the purpose of the boards. If you see that there are terms that allows for some flexibility, that's going to be considered better than your absolute exact items. Unless there are sentinel articles out there that are talking about specific numbers and and everyone is expected to know that specific number, that's the only time that you would pick a specific value. But having some flexibility is not a bad thing. All right, next one. Each of the following statements about cholesterol is true except cholesterol contains numerous fatty acids. Cholesterol is not present in any food or plant of plant origin. Cholesterol is required in many complex bodily functions, or endogenous cholesterol is produced within the body. And I'll give it 5 more seconds. All right, so 71% picked option B, which is cholesterol is not present in any foods of plant origin. And then there's a good amount of spread between options C and D. The correct answer is actually A. So what was the flaw in this item? It was the word except. So basically, 3 of these options are correct, and it's asking for the incorrect one. Oh, oh, yay! So we had at least like one group of folks who answered A. So and I had to look this up, and that is the correct wrong answer, if that makes sense. So the problem with these items is that as clinicians, we are trained to look for the correct answer, right? We're not trained to look for all the wrong answers, and that's the problem with this item. So every once in a while, you will encounter something like this. So the important thing here is read the lead in, and if you see except, least likely, not pay close attention, because now they're asking for the incorrect answer, and it becomes trickier because you're thinking backwards. Yes, and these are negatively phrased lead-ins, and this is something that we should, as item writers, we should try to avoid. And at least for like USMLE purposes, like if there's like a negatively phrased lead-in, that's scrapped almost immediately. And I'm hoping that it follows through with like all of your other with other boards as well. All right, next one. Administration of furosemide results in A, decrease in urine potassium, B, an increase in urine potassium, C, improved glucose control in patients with type 2 diabetes, D, no change in urine potassium, E, requires decreasing the dose with renal failure. And I think with this one, oh, was there a question? Okay. I think for this one, it's a lot more straightforward because we know furosemide causes potassium wasting, so it increases the urine into potassium. So that's good because like you all got the correct answer because you know it. If, however, you're guessing because you don't know the correct answer, how do you dissect this? How do you eliminate options? Or I guess what is the flaw here? So this is an example of a collectively exhaustive set of options. What that means is options A, B, and D really cover the entire spectrum. You can only have a decrease in the urine potassium, you can only have an increase, or you can only have a no change. Nothing else should exist. So what happens here is when the item writer has envisioned what they want as the correct answer, they create options that are revolving around that. And if they run out of options, they just create other uh, less effective distractors, which is going to be options C and E. And they're not useful. They're not helpful when it comes to figuring out who knows the correct answer or not. Um, but yeah, so that's how you eliminate options when you're guessing, especially if you see like a good, like a good comprehensive, like exhaustive set of options. Items that don't fall within that range can be excluded. It should, from Deborah, so it should be A or B. It has to be one or the other. Well, that's also a possibility. Either that, or if the values don't have to change, then you can have no change. But important thing is like option C and E, right off the bat, you can eliminate them. Right, and that's also a good observation. Three of these items mention urine potassium, right? So exactly. So when the test like the item writer was creating this item, and they already had like the correct answer they had in mind, they were just like trying to create options around that, and it became very obvious that it's going to be either A, B, or D, which is going to be the correct answer. Next one, secondary gain is a complication of a variety of illnesses and tends to prolong many of them. So over three, a frequent problem in obsessive compulsive disorder is never seen in organic brain damage or is synonymous with malingering. And we have like around 8 minutes left, so I'm going to speed things up a bit because I want to be able to like get to the end of the talk. But so that's what we see. 67 say it's synonymous with malingering. Um, the correct answer is actually A. And the reason why that's the correct answer, and the flaw here is that the correct option is the one that stands out. It's because many item writers are teachers, are educators, and because of that, it's very easy for an item writer to try and quote unquote pimp people out, right? They're trying to teach. So if you see an option that is sort of telling you that it's this and this because of this, there's a good chance that that's potentially going to be the correct answer, especially if you're just guessing. Plus, if you all look, option A here is the only one that presents two different items in that one option. It's a complication and it tends to prolong them. It's mentioning two. All the others are only giving you one item for every option. So it's almost like trying to convince you that, hey, option A is the correct one. And because of that, it makes it a more like a more correct option, which in this case, it's the correct one. I got confused because I also thought it was like synonymous with malingering, but it's not. They're like very similar, but it's not synonymous. And we'll move on in the interest of time. Next one, a 58-year-old man with a history of heavy alcohol use and previous psychiatric hospitalization is confused and agitated. He speaks of experiencing the world as unreal. Which of the following best describes this symptom? A, depersonalization, B, derailment, C, derealization, D, focal memory deficit, E, signal anxiety. And I think we can move forward here, but this type of flaw is called a clang clue. So clang clues, and majority of y'all got the correct answer. So clang clues are whenever you see words that are repeated from the vignette and you see them show up on the option set. So for this example, it's the word unreal, which contains the word real, which really makes the realization the correct answer, which truthfully it is the correct answer. But another example is if in the vignette, if it mentions, like, for example, bone pain, and if you see an option that has the prefix osteo, look at that option because that might be the correct one. Now, this is an example of a grammatical cue. This is a lot more straightforward, and the correct answer here is A because it's the only one that makes sense. It's the only one that starts with a vowel. Everything else starts with a consonant, and this is a lot more straightforward. But every once in a while, especially for like your like the practice board exam questions, for the poorly written items, sometimes you will still see this. Ooh, this is a good one, and we're getting close to the end here. Local anesthetics are most effective in the A, anionic form acting from inside the nerve membrane, B, cationic form acting from inside the nerve membrane, C, cationic form acting from outside the nerve membrane, D, unchanged form acting from inside the nerve membrane, or E, uncharged form acting from outside the nerve membrane. So this is good. This is good that we're seeing some spread here. And I'll close it in 5 seconds. All right. So if you're guessing and you have something like this flaw is called convergence. And convergence happens when, similar to one of the examples earlier, is when the item writer already has the correct answer in mind and they wanted to create other distractors, but they're not really good with creating distractors, and they end up creating something like this. So what happens is they create permutations of the correct answer. And when you end up seeing something like this, just look at the numbers. Take note of repeating terms, and we'll go through this like quickly to help you figure out which one is the correct answer. So first of all, there's 3 items that mention the word inside. So because of that, just by looking at the numbers game, you can eliminate options C and E. And then options A and B have charges, anionic negative charge, B cationic positive charge, versus option D, which doesn't have a charge. And if you think about it, A, B, and C all mentioned charges. Option D and E are uncharged. So by virtue of number of repeating terms, you can eliminate option D. Then you're up to a 50% chance of guessing the correct answer, right? Then you're left with options A and B, and then option A mentions anionic form, option B is cationic, but option B and option C, even though it's already scratched out, it's crossed out, both mention cationic. So option B is the correct answer. So especially if you're guessing and if you have time to burn, right, and you really have to guess, looking at conversions and looking at the numbers can be helpful. And really some bonus content here. Again, all the things that have been mentioned here are available on the web. I'm not breaking any confidentiality here, right? So if you all go to the ABIM website and look for the Hospice and Bowel Medicine Certification Assessment, they have the HPM tutorial. You guys should explore that. Why? Because it will give you all the different sorts of calculators that are available for you when you're taking the exam. So for example, there's, you have like the hospice and palliative care calculator there, and it gives you all of these information. So what I would do is like maybe a week before, a couple of days before the exam, double check again if this is available on the ABIM website, because if it is, then chances are they will provide this information when you take the boards. And that's helpful because you don't have to memorize things like opioid conversions because they will provide them, right? And looking at all the other calculators like your ESAS or like your palliative performance scale, it's helpful because you don't have to burn so many neurons trying to memorize all of these things, especially if they're going to be provided. So just some bonus tips. And y'all got this. And that's perfect. It's like at the end of the hour, these are my references. And that's it. So I know it's the end of the hour, and I don't know if y'all have any questions. That's my email. If you wanted to shoot me an email, if you have like any other questions, I'll be more than happy to like answer them to the best of my ability. Do you have access to ABIM resources? If not certified in IM, absolutely. Just Google ABIM HPM certification assessment. They will give you like all of the resources that are available. So just go look at them and familiarize yourself because that saves you time when you're taking the exam.
Thank you, Rex. What a great presentation. And it is so important to at least frame how you're thinking about the exam, even as you start fellowship. I remember walking out of the exam and people were saying, "Well, how'd it go?" And I said, I learned so much today. But the helpful thought in the back of my mind was, well, there's 40 throwaway questions in there, and some of them are not written great. You don't have to get them all right. And I think that part of my marathon personally was realizing that I'm not going to get every question right and not being disheartened when there's two or three in a row where I just had no idea. Use your test taking strategies to the best of your ability, right? Anionic, cationic, neutral, whatever. But know that if you studied and you're feeling confident about it, there's a good chance you're going to pass. It's like a hitting streak in baseball.
Right.
You may hit really poorly for a while, but if you can get out of it, it's just a mental game.
It is. It is a mental game. Yeah, I remember when I walked out of the exam and people were asking me, "How did it go?" My response was, "I don't know."
Yeah. And I mean, I didn't crush it, but I had an average score, which for me was crushing it as a below average test taker. Uh, but like you said, I think the I forgot the term for it, but the layered studying, the recall where you're studying one subject and then you'll come back to it in a couple months is a great way to do it. Or even thinking about what you're seeing clinically. If you're on a cardiac rotation, plug in heart failure into the question banks and see if you can just get some questions about the topics that you're learning at the time.
Yeah, and I think that's like the best way to go about it, especially when you're doing your rotations, is you want to enforce that hand in hand with like the material, the study material, right? Because that's how you reinforce like all of the things that you encounter when you're taking care of your patients.
Absolutely. Yeah. I mean, that's the thing is make it feel, force your program directors, remind them that this is a training program and make sure that you have time to learn about your patients and learn the things that are important for the boards while you're providing clinical care.
Yep.
All right, everyone. 2 hours down. We'll take a 10-minute break and be back at 15 after the hour. I put the next Zoom link in the chat. We move from Zoom to Zoom like nomads, really just for YouTube video processing later on. So thank you for humoring me with that. We have two great lectures coming up, one about providing culturally competent care in the setting of the Chinese community, but with implications for just greater culturally competent care. And then a lecture on ethics at the end of life. So it'll be a great way to close our first day. Rex, thanks again for your friendship and your help as always. Great lecture.
Thank you. Thank you, Ben. Thank you, everyone.